We all know basically what healthy skin looks like. It just looks radiant and soft and smooth. And we also see what skin that's not looking that great. It's telling us it's angry about something, typically, or it's telling us it's weathered from climate or age. Or here are the primary sources used for this deck. They're mostly the same as a lot of the ones that I've been showing you. So skin, and this is just an opportunity to show you some healthy skin of my family. This is my daughter Cora and her girls, and they're all older now, but I just loved how you can see like healthy skin. You know it when you see it. It's smooth. It's not discolored. It looks healthy. But when somebody has skin problems, you can see different things. You can see an absence of discoloration or paleness. You can see jaundice. You can see this person has some acne, a little bit cystic acne. You can see dryness, peeling, eczema, psoriasis, rashes, itches, so many different manifestations when skin's not happy. And skin it's our largest external organ. And so the things we use on it, the things it's exposed to, one of the ways that we detoxify is through skin. And so in a naturopathic viewpoint, naturopaths will say healthy people get skin issues, and people who are less healthy, it goes deeper and deeper into the organs. So we can look at dry skin. And I think there's two main reasons why people have dry skin. One is because they're dehydrated. If they're dehydrated, you might see reddening of the skin. You might see it just feels dry to the touch. And then you also have people who have not enough oil in their skin. The sebum is not discharging as much as it ought to. And so as far as nutritional insufficiencies go, you start seeing essential fatty acid, usually omega-6, but the omega-3 fatty acids, borage oil and evening primrose oil, are very useful for people with skin issues, with acne and rashes and hives. Vitamin A again shows up. Again, vitamin A is so protective for epithelial membranes inside and outside the body. Biotin, you're not really going to see a lot of biotin insufficiencies unless somebody's eating a lot of raw eggs. There's a protein molecule in there called avidin that binds vitamin A, that binds biotin. Zinc, dehydration. And again, medically, we often see dry skin in people who have thyroid issues. Scaling skin. This looks like alligator skin. You can see on that person's finger, it's like really rough and it looks like scales. And deficiencies that are associated with it, again, are vitamin A, zinc, and essential fatty acids. And again, those omega-6 fatty acids, or eating more nuts and seeds, this is where those come into play because they can really help with skin. Excess vitamin A can also cause this. And high sources of vitamin A are cod liver oil, beef's liver, calf's liver, lamb liver, any kind of liver, chicken liver, and in supplements. If you see it, start thinking most likely deficiencies, but possibly could be vitamin A excess. Okay, so bruising. Bruising really happens when we knock ourselves on something, right? And it's a reflection of an injury. Petechiae and purpura are less associated with injury, but bruising is very much about injury. I got into a fight with my roses while I was pruning them the other day. I was pruning the one in front of me, which is big and doesn't have a lot of thorns, but the one behind me has the most nasty thorns on it. And it got me from behind and my arms got so bruised up. Anyway, but I think about vitamin C. I think about bioflavonoids. Like vitamin C, as I've mentioned before, it's so important for capillary strength and keeping capillaries and blood vessels strong and have good integrity. And so when we see a lot of bruising, you can start thinking vitamin C. And then somebody who's on blood thinners, they could have vitamin K excess because of the vitamin K in foods in their diet. or maybe they're taking a bone supplement that has vitamin K, and that can also cause excess bruising. I know that my mom, when she was in her 60s, sometimes my dad would grab her arm and go, "Hey, Sil, take a look at this." And the next thing I knew, she had a bruise here and a bruise there. And like, Mom, you need a lot more vitamin C than you're getting. So, you can see bruising easily. Also, if you see a lot of bruising on somebody, a good question to ask them is, are you safe? Are you physically safe, or did this come from somebody hurting you? I know that when I fill out medical intakes these days, there's always that question, do you feel safe? And I really love that it's there. I do feel safe, but there are people who don't feel safe. And if they feel like they're in a safe place when they can express it, then maybe you can be that first person who really helps. Follicular hyperkeratosis, this is bumpy skin. You often see it. Why it's called a follicular is that it's the same way you get goosebumps. It's actually the hair follicles that get a little bit inflamed. And I see it a lot on little kids on the back of their arms. So just feeling the back of somebody's arm or looking at the back of someone's arm, this is the most likely place you're going to see it. And again, it's a vitamin C deficiency, an essential fatty acid deficiency, or a vitamin A. Are you starting to see a pattern here? Essential fatty acids, vitamin C, vitamin A, think skin. Actinic keratosis, it's scaly, reddened skin. I just was at my dermatologist and she saw a little one on my nose and she took her little cryotherapy canister and just zapped it. She's, little keratosis there. I don't like it. So let's just get rid of it. So it's scaly, it's red. It can look like a mole. It can be red or tan or brown. They can look like rough moles. So if you're feeling and you feel a roughness on your skin, it's likely actinic keratosis. And mostly it means you need more omega-6 fatty acids. So start thinking about eating more oily fish, tuna, halibut, salmon, sardines. I often for lunch, I like to just grab a tin of sardines and have a salad with that and maybe some crackers, or I like having tuna or canned salmon. These are foods that are not expensive. It's easy for people to have them around and they work really well. So red wine is protective, especially red, but white has some protective factor to it. And they can be a prelude to skin cancer. So if you don't keep them nurtured, so, if you have a lot of actinic keratoses, you might want to put healing oils on your skin. You might want to make sure you use lotions that are nutritive. These can help. So I guess this is out of format. I thought it would be right after the bruising slide. So purpura, this is bleeding under the skin. And this can be from an injury, but usually it's that the blood vessels are soft. They're a little bit leaky. And so bruises are like you smacked yourself on something, but this is more that really the blood vessels themselves are not that good. I notice like the slide on the bottom right, every once in a while I'll do something. And as I get older, my skin just seems thinner and I'll get a small one of those. And I go, wow, it's like a blood, like just this odd thing. And that's a purpura. So the problem for purpura deficiencies can be in vitamin C or K, too much vitamin E. But I've also seen in petechiae, I worked with somebody who vitamin E actually got rid of all of her petechiae. So, I always have to look. Blood thinners can cause this injury and thrombocytopenia can cause it. Petechiae, I really think about vitamin C and bioflavonoids first. And you often see petechiae on the skin and the face. You can often see it around the nose. And petechiae, as I said, it's interesting. I had a neighbor when I was younger and she was pregnant and she had petechiae all over. And I'm like, I think some vitamin C. And then we also added some vitamin E as wheat germ oil. And she just loved the wheat germ oil because her mom used to give her wheat germ oil when she was a child. And she just started having a fair amount of it, and the petechiae just disappeared completely. I also think that with petechiae, there can be abnormal blood clotting. They also happen as a result of severe fever or bites can cause petechiae too. And bruising, we already talked about vitamin C, vitamin K. Skin tags. I remember a young man that I was working with, and I noticed on his skin all these skin tags around his neck and chest. They're soft, they're pedunculated, so they're attached at one point. They'd be fun to play with. If you had one, I think I would. I like picking at things. And they look like a puffed rice. They can be reddened. They can be the same color as the skin. And you'll see them, and sometimes even on eyelids. And to me, they always are a sign, could this person have insulin resistance? Could this person have diabetes? Because they are really a sign and a signal for that. And so I would always refer somebody back. But if you see a lot of skin tags, make sure that you've checked somebody's fasting insulin levels, and that make sure that, or even a 2-hour fasting level postprandial. It could be just from clothes, but most often it's associated with some kind of diabetes or insulin resistance. The person might also be experiencing high triglycerides or low LDL cholesterol. Again, the skin tells us tales, so good for us to listen. Dermographic skin. This is where we used to see this quite a lot when I was working in the autism community. You can actually write on someone's skin. You just take your nail and you write their name on it or whatever. And for me, I'm scratching my skin. You're not seeing erythema. You're not seeing redness. But in somebody who's got a lot of allergies, you can see a hive that lasts up to a half an hour. And this person has L503 on their arm. I'm not sure what L503 represents, but it was a picture that I could find that could show you this. And you start thinking about allergies. This is a histamine response. So why is somebody having this aggravated histamine response? Do they have mast cell? Do they have food allergies? Do they have environmental allergies of some sort, hay fever, or what's going on? And so working with a good allergist can help you figure out what's going on here, or running your own IgE testing for this person. And it may also be associated with dysbiosis and gut issues, leaky gut and other gut issues. So, if you have somebody and you suspect maybe mast cell issues, well, write on their skin, see what happens. It's a fun thing to do. Okay, poor wound healing. So this picture has absolutely nothing to do with poor wound healing, but I thought showing you wounds wasn't fun. This is a little piece of a Halloween fairy village that's near my house. And every time I go by it, I take more pictures because it just fascinates me. So poor wound healing, I think primarily, not enough zinc, and I think not enough protein. Vitamin C also plays a role in wound healing that's really important. So nutritionally, those three things, zinc and protein, are a big deal. We're in a moment in time where we're seeing a protein renaissance. We have people like Dr. Gabrielle Lyon, who happens to be my goddaughter, who's promoting muscle-centric medicine, that when we have more muscle, we are healthier. And so a lot of people aren't getting quite as much protein as they need. And so thinking about that, especially on the other hand, we have more vegan, more vegetarian focus. So just thinking about, is this person getting enough protein? And looking at a food diary can really tell you that at a glance, or can tell a good nutritionist or dietitian at a glance anyway. Sometimes people have poor skin care, or diabetes, or steroid use can also delay wound healing. And I think you know about those.
If you're a licensed healthcare practitioner ready to evolve your functional medicine practice, explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.